Today we are here with Janet Snipes, Executive Director Consultant of Holly Heights Nursing Center. So how did you get started in this profession? Were there any specific people or events that made you choose this as a career?
There were. My mother was coming back after a long hold on her career. She's a registered nurse, and she started working. We moved from the mountains to the city, and she started working at Holly Heights Nursing Center. And at that point in time, she was working as Assistant Director of Nursing, Infection Control, Staff Development, kind of an all-encompassing position. But again, that was 1976. And she called me one day and she said, you know, the receptionist is gone and we need someone to answer phones. Can you come and answer phones? And I said, sure. I was on a scholarship to go join a ski team in Durango and went and answered phones, and I loved it. It was just, I so enjoyed it. I enjoyed the residents, I enjoyed the staff, and kind of changed my career at that point in time. Changed my life, actually, because you think, okay, go to college for a ski team versus join a long-term care facility, but I loved it and went through college after that, part-time, while working in the nursing home. Loved it.
And the rest is history.
Exactly.
Now, you've served in many leadership roles over your career. Chair of the Colorado Healthcare Association, AHCA Quality Cabinet, AHCA National Champion of Quality, among others. With that insight, what is your outlook on the role of long-term care in our country?
I think that leaders are going to need to be strategic moving forward. We're going to need to diversify. We're going to have to look at population management. We're going to have to look at ISNPs. We're going to have to look at different populations for each unique and individual facility that leaders operate, and decide what is best for that facility and move forward by diversifying and being involved in other entities.
Mm-hmm. Absolutely. That diversifying gives you such a different perspective on things. So some aspects of quality care can be a little bit difficult to define. What is your approach to ensuring that quality care is delivered within a center or across a company?
I believe that my success, and I believe others' success, can be through their QAPI programs. As you mentioned, I was a Gold Malcolm Baldrige Quality Award winner, and that program taught me the basics and later defined what quality is and how to define it through processes and systems and how to make sure that you're catching any challenges that you have and having the opportunity then to early recognition and early intervention. For example, during the pandemic, we noticed as we moved to room trays for all of our residents that we redefined our dining process like 15 times, and because early on we were experiencing weight loss. But we identified it early and we were able to intervene and redefine our dining process and assure that quality was being delivered to our residents. Hot food, in the beginning, we didn't have enough hot food carts. And we had to buy new carts. We had to have people deliver the food. It was all different for us. But because we had that basic Malcolm Baldrige process identified, we were able to quickly identify and quickly develop interventions so that we did deliver the quality of care.
So the processes really gave you that flexibility and ability to pivot when things changed.
Absolutely.
That's wonderful. So how can centers who are facing workforce shortages, prospective margin cuts, how can they ensure that they're still delivering quality care despite those challenges?
I think each facility is unique and they need to evaluate it within their own facility. I know in our facility, which is just a single individual facility, we looked at a number of things. One of the first things we looked at was job descriptions. You know, where can we, nursing was short a lot. So we needed to supplement nursing, and where could we do that and still deliver quality of care? That we had dietary go deliver all the room trays, and they delivered the snacks, and they were so engaged with the residents that they developed relationships, and they started buying snacks on their own time so that the residents could have the snacks they wanted, which that too helped with the weight loss. And we had other departments too. Was stocking the carts outside of the infection control PPE carts outside of each room. That was really a time-consuming job. Nursing didn't have time to do it. Nursing was totally consumed with all the COVID tests they had to do. And so we identified, okay, who could do that? And in our situation, it turned out that our laundry supervisor, she was very well organized. She kept inventory, she ordered the correct supplies, she stocked the carts. It was amazing the things that people could step up and do, and we're happy to do, because we needed that and still free up nursing to do nursing tasks that no one else could do. I think every center has to be unique in trying to decide, how do we get the care to the residents that they deserve and still continue our operations as we have to do otherwise.
So interesting. It's the challenge became the opportunity to re-examine those pieces and think about them in a new way.
Exactly, and it's amazing the staff that stepped forward to do that as well. The staff were so, when we told dietary, first of all, we need you to go to each unit and we need you to pass the trays, the coffee, everything like that, because we hadn't done that. We had a dining room. We had multiple dining rooms and people dined in the dining rooms. And they were hesitant at first, but then they built these relationships with the residents, and pretty soon they're leaving the cart to go get such and such for so and so. They're leaving on their own time to go buy the snacks that the residents want, and they're loving it. And it was actually very rewarding to see.
Wonderful. Building those relationships is so critical.
Absolutely.
In what ways do you recommend that long-term and post-acute care professionals get involved to support the future of long-term care?
I speak highly, obviously, because it's what my career has been about, but about getting involved through your state association, through the National Association, AHCA, get involved in any meetings your state survey agency is having, any meetings healthcare policy and financing is having, getting involved in your state legislature. You need to tell your story. Your story is different from anyone else's story, and it's so important to have everyone understand what you are going through, especially after this pandemic, but the idiosyncrasies of your organization. And then you can be a voice for not only your facility, but others as well. You're a voice for your staff, you're a voice for your residents, you're a voice for your family members. You can be part of the solution. I try hard to go to these meetings, identify the problem, but also identify what I think would be a good solution. And I think it's so important that everyone be involved in these meetings, because my building will be different from someone else's building, and the larger corporations will be very different as well, and we all need to be that voice at the table. So get involved with all those different areas.
Yes, I like how you mentioned the state level as well as the national level, that there's really a place to make an impact in both places.
Yes, we have been working in Colorado with our state Medicaid agency because personally, my building, we are a long-term care facility, so people live there as their homes. We have people that live there 18 to 20 years. So we're really their family members. And they need to have a different story on the Medicaid level than the short-term subacute people do on the short-term level. And so we need to be involved with Medicaid, and we need to talk to them about value-based purchasing and our Medicaid rates and how COVID has impacted the care that we give and the labor shortage. It's just incredible how we're increasing wages each and every day. Medicaid needs to understand that, and we need to have a collaborative conversation and come to solutions.
Yes, I like that collaboration. That is the key word to solving these large industry-wide challenges.
Definitely, sure. Yes, I agree.
Wonderful. Well, thank you for spending some time with us talking about quality care. I really appreciate it.
Quality is my passion. I'm happy to. Thank you.